Today's lecture is on patient management, the appointment book. We have computerized scheduling these days. This is the advantage of blocking spots for emergencies, information accessed simultaneously, problem patients are identified, we search for upcoming appointments in free time, reports overall schedule practices, and color coding as visual aids. So each practitioner has their own color, so you'll know when each practitioner is seeing patients or needs to be away from the office. Online scheduling. Patients can schedule, and it's not recommended for all practices. So you'll have to check with your doctor's office and find out if patient scheduling is available. When you go to your externships, one thing you can ask is, can the patient schedule on the patient portal? And usually scheduling is done by a central scheduling office these days, not necessarily anyone in the office. Applying the matrix. What is a matrix? A matrix for appointment scheduling. The matrix is all the available times on the schedule. So slots sometimes are open for available appointments. Sometimes areas are blocked off for alternative activities such as seminars, vacations, meetings. So the matrix we show on you'll see it in your book, and you'll also see it in some of your homework, is set up so that you can see what's open and what isn't. We always put in the patient name and the purpose of the visit. We usually have abbreviations in appointment scheduling. For physical exam is a PE. A follow-up is usually F/U. So you'll learn the appointments as we go. Standard appointment times. Do we have a 1-hour appointment for first-time physical exams? Do we have a standard appointment time for follow-ups after delivery of a child? Appointment book is a legal record, and it can be subpoenaed by the courts. Appointment scheduling systems. We have open hour scheduling. We have time specified scheduling, be here at 9:15. We have wave scheduling, when we'll set up a 4-hour appointment for everybody that has to come in for return visits after surgery. We have a modified wave scheduling when smaller amounts of time are set up for that. We do double booking when we can put 2 people in the same time slot. Cluster scheduling is when we set up a appointment. It's similar to wave scheduling in a sense, but cluster scheduling is the same type of appointment, all right? Such as school physicals. Thursday afternoons, we have cluster scheduling. Everybody can come in for school physicals. All right. And we have combination scheduling and advanced scheduling, depending on what the practice needs. One more time with wave scheduling, please, is that we might have an open 3-hour appointment for people who need to come in for blood pressure checks. And so they just come in whenever they come in. They don't have an appointment, they just show up. Okay. Organizing and scheduling appointments. New patients need longer times than established patients. New patients will sometimes come in for a 15-minute meet and greet and then be scheduled for a full exam, physical exam, 3 or 4 months later. Established patients come in and you can go in for a blood pressure check or a medication check. Appointment confirmations. They may give you an appointment card. We have encounter forms and super bills. We have reminder mailings, we have confirmation calls, and email notifications. I know with my office, I will get a text message, I will get a phone call that I have an appointment coming up. Patient scheduling situations. We have emergencies. Most emergencies you're told to go to urgent care or an emergency room for a true emergency. But if you have someone coming in, maybe their child has a high fever, they need to be seen right away. Most offices will keep some slots open for that type of emergency. Referrals. For offices that are specialties, most office visits are referrals for the first appointment and then returns after. Fasting patients. We may have to schedule fasting patients to have their blood drawn to see whether it's in the lab or the office, to see what their blood glucose is. Patients with diabetes need to be seen on a special time because we may need to check on their insulin levels. Late arrivals and walk-ins have to be dealt with according to patient policy. Cancellations. We prefer to have 24-hour notice on cancellations, and Mr. Wrong Day appointments are noted as such and are kept track of. If there are a lot of missed appointments or cancellations, again, from a prior lecture, you understand that the practice can dismiss the patient. Scheduling outside appointments. So we're scheduling outpatient procedures. So we're going to schedule appointments for consultations and referrals. So you broke your shoulder, you go to the docs, you find out it's broken. Now they're going to schedule you with an orthopedic surgeon. All right. We may schedule for a laboratory test. You go to your doctors, you're going to have a physical. Okay. We're going to schedule your lab work for next year, 10 months from now, 11 months from now. Here's your lab work. Imaging studies. For people, we may schedule a chest x-ray or an x-ray of your hip because it's sore, and other diagnostic tests as well. We will set up a hospital admissions through the admissions department. Some physicians follow their patients to the hospital, some do not. Surgeons will use the hospital admissions department to set up your surgery, whether it's inpatient or outpatient, all right? Inpatient surgeries can be set up in a hospital or an ambulatory care surgical office or building, and we can do outpatient surgery sometimes right in the office. And as a MA, you may be reserving the operating room through the scheduling of hospital admissions. Maintaining the practitioner schedule. Overbooking and underbooking. We don't overbook and we try not to underbook. The insurance companies only allow so much time per office visit. Did you know that a lot of insurance companies are the ones who decide how much time will be spent with a patient? Visits outside the office. These are house calls, or they call them mouse calls. All right. Again, house calls have come back, and physicians are visiting their patients at home. Hospital rounds or nursing home visits, depending on the type of practice you're in. If you are a surgeon or a specialist, you may have to go to the hospital to see your patients, or to go to nursing homes for monthly visits or bi-monthly visits. Scheduling pharmaceutical sales reps is done by the front office, and there are specific dates and times for the reps to come in. Making travel arrangements or itineraries. I don't know that MAs do that. I'm not quite sure who would, but maybe you've got a practitioner who has to go to a seminar and has asked you to make travel arrangements. Planning meetings and meetings minutes, taking minutes at the meetings, but you may have to set up a meeting for the office. So let's schedule a meeting for the office and block out Thursday from 4 to 5 for an office meeting. All right. And then scheduling time with the practitioner. Maybe you actually need to sit down and talk to your practitioner to find out what's going on and what his schedule is like. So those are a few things on schedule management of the office.